The hardest part of learning the anatomy of the skull is visualizing how all of the bones fit together three-dimensionally. So in this video, I'll teach you how to identify all of the bones from a frontal, lateral, and inferior view. Then we'll use the cadaveric images from Anatomage, the creator of the world's first life-size virtual dissection table, to see how all these bones, like the ethmoid and the sphenoid bone, fit together inside the skull. If you're ready to take the anatomy of the skull and get it to stick in your brain long term, then I got you covered. So let's jump to the whiteboard and get started. By the way, as we go through the parts of the skull, I have a free study guide. It has a notes section. It has practice activities, questions to answer. So that free study guide, it's linked in the description and the pinned comment below. Check that out if you think it would be helpful. So let's start with the lateral view of the skull. And there's really two parts of the skull that we need to know. There's the neurocranium. So the neurocranium is going to be all of the bones that touch the brain, that encompass or surround the brain and protect it. And then we've got the viscerocranium, which I have here in pink, and those can be all the bones that make up most of the face. I'm going to leave this kind of faded background here so you can see where these different bones connect. We're going to build these in one at a time, starting with the frontal bone. The frontal bone is in the front of the neurocranium, and it also will cover part of the orbit. So the orbit is like the bony area around the eye. And so the superior part of the orbit right here is made up of the frontal bone. The frontal bone is going to articulate with a lot of other bones. The parietal bone right here, the sphenoid bone right here, zygomatic bone, lacrimal bone, maxilla, and nasal bone. So lots of bones that it articulates with. We're going to learn all of those. If you didn't catch everything I just said there, that's totally fine. Let's take a look at what that frontal bone looks like in this model from Anatomage. And so we can see here, as we strip that away, there is the frontal bone. We can see here, this is the coronal suture. We'll label that in the diagram in a second. The coronal plane is the same as the frontal plane. It kind of goes like this. And so that suture is going to exist in that coronal or frontal plane. So we call that the coronal suture. And you can see also that it makes up the superior part of the orbit there as we build that skeleton back in. Up next, we have the parietal bone. The parietal bone is actually two bones, and those are going to make up kind of the top of the skull up here. You've got a left parietal and a right parietal. We've got two sutures I want to label now. The coronal suture that we already talked about, and that's going to be between the frontal bone and the parietal bone. And you'll see it kind of like waves back and forth like this. So most sutures do that as these bones grow together. We also have what's called the sagittal suture. So the sagittal plane goes like this, and that's going to separate the two parietal bones. So we have the sagittal suture. I've got it labeled right there, but it would be running along the top of the skull in that mid-sagittal plane, separating the left and the right parietal bones. We can take a look at what that looks like here in our model from Anatomage. So this is that sagittal suture, and you can see the left parietal bone, the right parietal bone. Here's the occipital bone in the back. This is going to be the lambdoid suture, because it looks like a lambda, like an upside down Y. It's a Greek letter that kind of resembles an upside down Y. And so as we go through here, we can see those two parietal bones. There's that coronal suture right there. One thing that's interesting, I think, is that the temporal bone right there actually overlaps the parietal bone in this region right in there. We can see it. So it's kind of interesting there. So that's going to be the parietal bones of the skull. Up next, we have the occipital bone. The occipital bone is going to be in the very back of the skull. It also forms kind of the base of the skull. And we've got that lambdoid suture between the occipital bone and the parietal bone. So the occipital bone will look like this. We see everything in blue here is the occipital bone. We'll see here it actually extends pretty far anterior or forward. This part right here is actually going to articulate with the sphenoid bone, which we'll look at in a minute. The sphenoid bone would be right here. And we've got this big hole in the bottom of the occipital bone. That's the foramen magnum, Latin for big hole. And that's where the brain stem of the brain is going to go down through there and forming the spinal cord. So there is that occipital bone, making up the back of the neurocranium. All right, next we're going to have the temporal bone. And the temporal bone is a very unique looking bone. First of all, though, we've got a suture. This is the squamous suture. If you know a little bit of histology, you know that squamous epithelial cells are the flat epithelial cells. And so squamous just means flattened. And so if you look at this whole region right here, it is sort of flattened. There's a ridge right here. This is where the temporalis muscle is going to originate. And so we have this flattened section right there. So that's how I remember it's the squamous suture between the temporal bone and the parietal bone. Now let's zoom in on this and label a few particular structures in the temporal bone. First of all, we've got the zygomatic process. The zygomatic bone is your cheekbone, which we haven't labeled yet. This process right here, along with the temporal process of the zygomatic bone, that's going to be this section right there, those form the zygomatic arch. You can feel the zygomatic arch, find your cheekbone, and then just go back from that, and you've got that ridge right there. That's your zygomatic arch, and it's formed right there between the temporal bone and the zygomatic bone. Next, we have the styloid process. We've got a few muscles that connect to that, like the stylohyoid. Those muscles are going to help with like our tongue movements, and there's a hyoid bone that's like underneath our jaw right here. We can see that styloid sticking out right there. We also have something called the external acoustic meatus. This forms the auditory canal, basically where sound is entering in our ear. So in this temporal bone picture right here, your ear is right in here. So this external acoustic meatus, that's the hole in your ear that sound goes in. Like I said, it's the auditory canal. And we've got one more thing I want to label on here, which is the mandibular fossa. So the mandible, or your jawbone, is going to articulate with the temporal bone. You may have heard of the TMJ joint, the temporomandibular joint. It's going to be the joint between the mandible right here and the temporal bone. So it's right in there. Now in the back of the mandible, we have the mandibular condyles. The condyles right there will insert into the mandibular fossa of the temporal bone, and so that joint can move like this. Again, condyle fits into the fossa for that temporomandibular joint. All right, inside of that auditory canal, that external acoustic meatus, and that meatus would be right here. That's the top part of it, the bottom part of it. And inside that middle ear, we've got the auditory ossicles. The reason I have them in this video, in this diagram, is because the auditory ossicles are bones. They're bones that are in the skull. We often don't think of them as skull bones exactly because their function is very different. They're not to protect the brain or form the face or anything like that. They're about transmitting sound, or the movements, the vibrations of the timpanic membrane, into the cochlea right here and then into the nerve. But those auditory ossicles, there's three of them. There's the malleus right here, the incus right here, and the stapes. And so those are going to be the three smallest bones in the body, and those are bones that are technically part of the skull. If you want to know about the ear and how the ear works, I've got a separate video for that. So now let's take a look at what this looks like in our model from Anatomage. We have the external acoustic meatus right there. There's the styloid process, the zygomatic process, forming the zygomatic arch right here. And we've got the mastoid process right there. And if I take away the rest of that, we can see some internal parts of the temporal bone. Right here is where the vestibulocochlear nerve is going to exit. And of course, the temporal lobe of the brain is going to sit right in there. All right, next we're going to label the sphenoid bone. Now the sphenoid bone and then also the ethmoid bone that we'll take a look at later, I think those are the two most difficult bones to visualize. So we're going to spend a lot of time taking a look at the different parts of the sphenoid bone. We're going to spend a lot of time visualizing that. Before we do that, I want to label one more suture. This is the sphenoparietal suture. They didn't come up with a clever name for it. They just named it after the sphenoid bone and the parietal bone. So sphenoparietal suture right there. Now let's look at the sphenoid bone in 3D. So one thing I want to point out first of all is we can see it in a couple spots. We can see the orbital surface right here that's behind the eye. And then we've got the lateral surface that we were just looking at in our diagram right here on the side. And you can see they're going to be kind of connected, kind of back behind this frontal and zygomatic bone right there. And you can see a couple holes in the back of the orbit. This is going to be the optic canal, where your optic nerve, where all the visual information from your eye gets sent to the brain. And we also have a couple orbital fissures, or these like long openings like this. We've got the superior orbital fissure right there, and that's going to have more nerves that are going to control like eye movement, and there's some blood vessels that go through there as well. And then we have the inferior orbital fissure, which we can see right in there. Now I want to point out those fissures because right here we have something called the lesser wing of the sphenoid bone, and right here we have the greater wing of the sphenoid bone. When I strip away the rest of the bones here, we'll see, and we'll be able to label those. So this is going to be the lesser wing of the sphenoid bone, and then everything else here is the greater wing of the sphenoid bone. We also have these two processes sticking down. These are going to be the pterygoid plates, and so this would be where the pterygoid muscles, there are these muscles underneath the chin here that help you to chew, in addition to the temporalis and the masseter. So that's called the pterygoid process, and there's a medial and a lateral pterygoid plate as part of that. And then if I spin this all the way around back here, there's this little opening right here called the sella turcica. That's actually where your pituitary gland is going to sit. So the brain is here, and the pituitary gland kind of hangs down and is protected by the sella turcica right there. Sella turcica is actually Latin for Turkish saddle. And I did not look up for this video Turkish saddles, and whether this looks like a Turkish saddle, I don't know, but that's where the name comes from. I feel like there's got to be a story there. Let me know in the comments if you know why it's named that. So there is our sphenoid bone. It looks sort of like a butterfly in the skull right there. And right in front of it is going to be the ethmoid bone. We've got the nose right in here. Behind the nose, we have the ethmoid. And then behind the ethmoid, spanning the whole length of the skull, the width of the skull, is this butterfly-shaped bone called the sphenoid. So hopefully that's helpful for you to visualize that bone. All right, let's label a few of those structures on the sphenoid bone I just talked about. We've got the greater wing, which is all of this stuff right here. We have the lesser wing, which is this part right here. And of course, that's on either side of that superior orbital fissure right there. This would be the greater wing on this side. There's a lesser wing and a greater wing on both sides of the sphenoid bone. We have the lateral surface right here. That's the part we saw, that's where your temple is right here. And we have the orbital surface right here. Of course, we have a lateral surface here, a lateral surface on the other side, orbital surface here, and then an orbital surface right in there as well. We're looking kind of at an angle. On the inferior side of this, we have those pterygoid plates, the medial and the lateral pterygoid plates. And then if we look at the back of this, I wanted to label that sella turcica right there, the Turkish saddle, or the indentation that houses the pituitary gland. Now we've gone through a lot of structures already, but I want to give you a chance to pause the video and see if you can label all the sutures and all the bones that we learned so far of the neurocranium. And then now we're going to go back to it. I recommend, as you watch the video, to pause here and there and to actually practice trying to remember all of these structures. That's going to help you learn it a lot better. Next, we have the zygomatic bone. These are going to be your cheekbones, zygomatic. That's the zygomatic region of the skull. And one part of this that I want to label is the temporal process of the zygomatic bone. And that's because the zygomatic process of the temporal bone, as well as this temporal process of the zygomatic bone, together make up that zygomatic arch that we already pointed out earlier, that ridge behind your cheekbone. All right, let's take a look at that in 3D. And so there is the zygomatic bone. We've got the frontal process connected to the frontal bone. We've got here is connected to the maxilla. And we strip that bone away. We can see that in 3D. And of course, there's that temporal process right there. All right, next we have the maxilla, or the maxillary bones. There's actually two of them. They connect to the teeth right there, the upper row of teeth. And this is kind of the cornerstone bone of the viscerocranium, because pretty much every unmovable bone of the face is going to articulate with the maxilla somewhere. It articulates with the frontal bone right here, the nasal bone, the lacrimal bone, the ethmoid bone right there, the zygomatic bone, as well as like the palatine bone and the vomer and the ethmoid, the bones we haven't labeled yet. Of particular note is it has this frontal process right here that actually goes up the side of the nose, and it also forms the inferior part of the orbit right there. Let's take a look at them in 3D and we can see that a little bit better. So here is the maxilla in blue. Here is the inferior part of the orbit that it makes up. Here's that frontal process that goes all the way up to the frontal bone. Here's the main body of the maxilla. And then there's this ridge right there that separates the right maxilla from the left maxilla. It also makes up a little part of the nasal septum right there, where it's going to connect to the vomer, and the ethmoid bone is going to be in there as well. And so we can see this if we come back here and strip the rest of that away. Got the zygomatic process, frontal process of the maxilla. This is called the alveolar process, where it connects to all the teeth. Particularly interesting, if you go back to here, there's this big empty area right there. That's the maxillary sinus. This is actually the largest sinus that you have, is that maxillary sinus. And I like this particular model here that we have from Anatomage because we can see all of the sinuses, I think. So let me go back to right here. This is where the sphenoid bone is. So that's the sphenoid sinus right there. We have right in here, you can see these kind of like smaller holes right there. That's going to be the ethmoid sinuses. So that's not one big sinus, but a bunch of little pockets. And then we have a frontal sinus. Let's see if we can see the frontal sinus here. I think we can see part of it kind of like right in there. That's the frontal sinus. So we've got the frontal sinus, the ethmoid sinuses, the sphenoid sinus, and then if I rotate this around, we can see the maxillary sinus right there. All right, now I need to go blow my nose. I used to be a lot sillier in my videos. Let me know if I need to bring that back. Do you like my dumb jokes, or just should I stick to the content? All right, let's jump back to our diagram. After the maxilla, up next we have the mandible. And so the mandible is going to be the jawbone. It's the one movable bone of the skull. It will connect to the teeth, the bottom row of teeth right there. Let's take a look at some of the parts of the mandible. So first we have the body of the mandible, and then we have a ramus of the mandible on either side. So the ramus is going to be this flat region right here that's going to stick upward from the body of the mandible. We have a couple things we want to label. Here's that mandibular condyle that's going to articulate with the mandibular fossa of the temporal bone. This is going to form your TMJ joint, or your temporomandibular joint. So that's that mandibular condyle. And then we have the coronoid process right here. That's going to be the insertion point for the temporalis muscle. So the origin of the temporalis and then that coronoid process right there is going to be the insertion. So origin of the temporalis, insertion of the temporalis. And that muscle will just pull up on that coronoid process to help us to chew. Of course, corona is going to be Latin for crown, and so this is kind of like a little ridge on a crown of sorts. And then this little foramen right here is the mental foramen. Again, we've got lots of these little foramen, these little holes throughout the skull. I'm not labeling most of them, there's lots of them, but this whole like chin part is the mental region of the face. Because just think of like, when you're thinking you might do this, you're thinking very mentally. All right, so let's take a look at that looks like in 3D. And so there is the mandible. We've got the coronoid process, the mandibular condyles right there. Here's the ramus, here's the body. And one thing I want to point out that I didn't label on my diagram here is there's another foramen right there. That's the mandibular foramen. And if you've ever had dental work done where they've had to numb the lower half of your jaw, they actually insert the needle into the back corner of your mouth and inject the anesthetic back there. Why are they doing it there and not like closer to the teeth? Well, that's because the nerve that supplies most of the feeling for your teeth is going to be going through that mandibular foramen right there. So they're actually targeting the nerve that goes through that mandibular foramen. Super cool whenever we can make a connection between like the real life stuff that we experience and the anatomy here. So that is the mandible. Now let's go back to our diagram here. We've got a few more bones that we're going to label. We've got the nasal bones right there. It looks like it would just be one bone forming the top part of your nose, but it's actually two bones. And we can see that here in our three-dimensional view. We see this little suture between the two nasal bones right there. So it's two nasal bones. Of course, it doesn't make up like the tip of your nose. That's going to be all cartilage right there. But this ridge right there is going to be made up of that nasal bone that we see right there. After the nasal bone, we've got the lacrimal bone. Now, your lacrimal glands are not on the inside part of your nose right there. Your lacrimal glands are more up here, kind of on either side of the orbit, more superior and lateral. But your lacrimal duct, or your tear duct, where it drains the tears out, is going to be on the medial side, right where that lacrimal bone is right there. And that Latin word lacrimal just means referring to the tears, or in Spanish like lagrimas. So just remember that lacrimal bone where your tears are right there. And we can see that lacrimal bone in our 3D image here. Just a pretty basic flat bone on either side there. And again, where that lacrimal gland is going to be up in here. But then where the tear ducts are going to be more on this medial side. Last but not least, we got to make a little space for this last bone, and that's the ethmoid bone. Again, the ethmoid and the sphenoid are the hardest to visualize, but I think what I'm going to do here is going to help out a lot. We're going to use the Anatomage images for this too. We can barely see that ethmoid bone sticking out there in the back of the orbit. Let's take a look at what that looks like in 3D. So here we see that orbital surface of the ethmoid bone. It's on either side. If I go back to right here, we can see a little bit of blue sticking out right there. It's actually going to form part of the nasal septum back in there. Let's strip away the rest of the bones and we can see what this ethmoid bone really looks like. Very interesting shaped bone right here. This is the perpendicular plate that's going to make up a lot of the nasal septum, along with the vomer, which would be down in here, and then part of the maxilla down in here. Here is that orbital surface. That's the surface that we can see. And then at the top of it, really interesting, we've got this plate right here that's got all these little dots that you can kind of see there. This is called the cribriform plate, and the cribriform plate is where the olfactory bulbs, or your olfactory nerve, is going to sit. And there's going to be these little fibers that stick down through those holes into the nasal cavity down here, and that's where our sense of smell is going to be detected. We also have, if we kind of move over to here, we've got the middle and superior nasal concha right there. The inferior nasal concha will be down here, but we don't see it on this bone because it's its own bone. The inferior nasal concha is a separate bone from the ethmoid bone. And then this ridge right here sticking up is called the crista galli. The brain is going to be right here, kind of the front part of the brain. This is considered a neurocranial bone because it does touch the brain in this top surface right here. So that's that ethmoid bone. And of course we have the ethmoid sinuses are going to be in here as well. If we go back to here, we build this back in, this is the sphenoid bone right behind it. And of course the nasal bone right in front of it. So it really sits right behind your nose. Now all the structures of the ethmoid bone, I'm going to label those on an image when we get to the frontal view in a little bit. Not pictured on here are a few bones, the vomer, the palatine bones that are going to make up part of your hard palate back there, and the inferior nasal concha. We'll see those on the other views that we have. So there's our completed diagram. Again, this is a great time to pause the video, see if you can name all the structures that we've done so far. Now we're going to take a look at a frontal view. We're going to go a little bit quicker because in the lateral view I was introducing all the bones for the first time. Again, we've got the neurocranium and the viscerocranium. The neurocranium that protects the brain, the viscerocranium that forms most of the face. And we're going to build those in one bone at a time, starting with the frontal bone. The frontal bone, we've got the supraorbital foramen right there. It just means above the orbit. So supraorbital foramen, and the frontal bone forms part of the orbit, the superior part of the orbit right there. We have the parietal bones, which we can see just a little sliver of right there, and we also have the temporal bones, which we can see just a little section of right there. And next we have the sphenoid bone, and so here we can see a lot of parts of the sphenoid bone. We've got the lateral surface as well as the orbital surface. Here we have the superior orbital fissure. There's the optic canal where the optic nerve comes through, and then this right here is this lesser wing of the sphenoid bone. This surface and this surface are going to make up the greater wing of the sphenoid bone. Take a look at that in 3D once again. Greater wing, so we've got the orbital surface, the lateral surface, the lesser wing right there, and the greater wing on that side. So again, there's the sphenoid bone, probably the most important one to be able to visualize three-dimensionally. And I want to show on my skull model as well what this looks like. So if I slide back here, there is the sella turcica, where that pituitary gland will live, and you can kind of see the outline of that sphenoid bone. Actually goes all the way up into here as well. This right here is where the optic canal and the superior orbital fissure are going to be. So sella turcica, and then here the optic canal and superior orbital fissure will be right in there. Up next we have the zygomatic bones. So there's the cheekbones on either side. We have the maxilla. Again, we've got the inferior orbital surface is made of the maxilla. We've got the frontal process of the maxilla right there. This is going to be the infraorbital foramen. We have the supraorbital and infraorbital foramen. And then we've got the mandible down here. Again, we've got the coronoid process that connects to the temporalis muscle. And we've got the mandibular condyles, which will articulate in that temporomandibular joint. All right, let's get that mandible back up there. All right, next I'm going to go through the bones that make up this orbit right here. So this is the nasal bones. We've got one on either side, and I use this as an acronym to help me remember the bones as we go from the medial side all the way over to the lateral side across the orbit. I find these bones a little bit hard to identify which is which because there's a bunch of just small sections of bone as we go back, and so I use the acronym National Medical Licensure Exams to remember this. Now that's not a real exam. In the United States we have the USMLE, but that doesn't work for the acronym here. So I just remember the National Medical Licensure Exams. All these doctors everywhere have to take the National Medical Licensure Exams. And so I'm going to go through these bones and follow along with that acronym as we go. So we have the nasal bone right here. Up next we have the maxilla again. I'm going to label it again right here for now just because it's the next one in the acronym and because we got that frontal process. So National Medical nasal maxilla. Then after that we have the lacrimal bone, so National Medical Licensure lacrimal. And then after that we've got the ethmoid bone, so we have the National Medical Licensure for lacrimal, exam for ethmoid, and then we'll have the sphenoid bone right there. That's the S in exams, so sphenoid, and then the zygomatic bone, so nasal, maxilla, lacrimal, ethmoid, sphenoid, and zygomatic. National Medical Licensure Exams. Hopefully that's helpful. If you have some other acronym, feel free to use that. Now I do want to talk a little bit more about the ethmoid bone. We can see the perpendicular plate right here, as well as the middle and superior nasal concha will be right in there. And then we got the orbital surface of that ethmoid bone. So I'm going to show this in 3D one more time. We see the orbital surface right there. And if I pull this back, we've got that perpendicular plate. We've got the superior and middle nasal concha. Pulling back to right here, we've got the cribriform plate and the crista galli right there. So we'll label them on this diagram. The orbital surface, the perpendicular plate that makes up part of the nasal septum. The superior and middle nasal concha will be right in there. And we've got the crista galli, this ridge that sticks up into where the brain is right there. And then the cribriform plate, where the olfactory bulbs are going to sit and the olfactory fibers are going to go down into that nasal cavity. In this diagram, we can see the cribriform plate is going to be right there. There's the olfactory bulb right there, and you can see those olfactory nerves that are sticking down into the nasal cavity. Of course, the nasal cavity isn't just like this big open hollow region. There's the concha in there. It's not quite as hollow as that diagram makes it look. And then I want to show that cribriform plate again. So if I go right in there, there's the cribriform plate and the crista galli right there. So sphenoid, frontal bones, ethmoid bone right there. Next, we have the inferior nasal concha. The inferior nasal concha, there's one on either side, so it's 2 different bones, and they are pretty small bones. We'll see those here. We can see them right there on either side of the nasal cavity. One thing I want to point out, you look, the nose is a little crooked here. Why are the models from Anatomage a little bit crooked here and there? Well, these are taken from actual scanned cadavers. This is not like an idealized version of what all these structures look like. We're looking at what these structures look like in an actual person. So the nose is a little bit crooked, one's a little bit higher than the other, because we're looking at an actual human here, which is really cool. And so we see those inferior nasal concha right there. Of course, the nasal concha will help swirl the air, warm up the air whenever we breathe in through our nose. All right, up next we have the vomer. We just see a little section right there. It's going to form part of the nasal septum, in addition to this ridge of the maxilla, the vomer, and then the perpendicular plate of the ethmoid bone. So let's take a look at what that looks like in 3D. We see that in blue. And one thing I want to point out, it's mostly this flat bone that kind of extends back, makes up part of the nasal septum. But in the back part of it, we see these 2 wings sticking out. And when we look at the inferior view of the vomer, we'll see those wings sticking out. So I want to point those out here. So that is our completed diagram of the frontal view. Not pictured, we did not have the palatine bones, and we did not have the occipital bone. And so if you'd like to, now's a great time to pause the video, see if you can name all of those bones on this frontal view of the skull. But we're going to continue on with the video for now. And now we're going to take a look at the inferior view of the skull. I really love this diagram. It's very visually interesting. It looks like something maybe out of a horror movie as well. I just think it looks really cool. Also, I don't have the mandible shown on this particular view, so we've removed the mandible, which would be right in here. Again, we have this divided up into the viscerocranium right here and the neurocranium, and this is going to be the anterior side. This is going to be the posterior side. So let's build this in one bone at a time. We're going to go quickly through these first bones that are not quite as interesting from this view, but we do have the zygomatic bones up there on the anterior side. We got the frontal bone. We can kind of barely see it right there. And the first kind of interesting one I want to label some stuff on is I almost call this the triceratop bone, because it really does look like a triceratop. We got the face right there. We got the 2 horns of the triceratop. Is anybody agreeing with me here? That looks like 2 triceratops like facing each other. Let me know in the comments if you think that's looks like that. Anyway, it's the temporal bone. And let's zoom in on that. I'm gonna just label these structures again. We've got the zygomatic process of the zygomatic arch. We have that styloid process right here. We have the mastoid process right there, where the masseter muscle connects to. We have the external acoustic meatus that forms your auditory canal right there. And we've got the mandibular fossa, where the TMJ joint will be. We've got a couple openings right here and right there. This one I believe is the stylomastoid foramen. And we've got the carotid canal, but I don't have those labeled on the diagram. Up next we have the parietal bones, and you can see them kind of sticking out right there and right there, just a little bit from this view. And then of course we have the occipital bone, which is very prominent in this inferior view. I want to label a couple structures on there. We have the foramen magnum we talked about, where the brainstem and spinal cord will exit from the skull. And then we have the occipital condyles right here and right there. Those condyles are going to be the parts of the occipital bone, or the parts of the skull, that will articulate with the top vertebrae, the atlas. So on my skull right here, you can see the occipital condyles right there and right there. And those are going to articulate with the atlas, the C1 vertebrae. All right, going back to our diagram here, let's label some of those facial bones. We've got the maxilla right there. And the maxilla is going to make up most of the hard palate, or the roof of your mouth. It's the anterior part of that. The anterior maybe like 2/3 of the palate. And then the posterior third of that hard palate is the palatine bone. Now the palatine bone we have not visualized in 3D yet, so let's take a look at what that bone looks like right here. So we have in blue that palatine bone, and it's going to have a process sticking out on either side right there. This is going to be the horizontal part of the palatine bone, and then we have the perpendicular part of the palatine bones that stick up in here, and they make kind of the back side walls of the nasal cavity. So those are the palatine bones. And just remember, you've got the horizontal part and the vertical or perpendicular parts of the palatine bone, and those are going to make up the posterior part of your hard palate, which is also made up of the maxilla right there. Those are the palatine bones. Now there are 2 of them. You can see a little ridge right there where they've grown together. So those are the palatine bones. All right, 2 more bones to label on here. We've got the vomer, which you can see right there. Again, we've got kind of the ridge of the vomer and then the 2 wings of the vomer. And I'll point those out just real quick here again. We've got those 2 wings, and that's what we're seeing, the ridge and then the 2 wings of the vomer. Those are the 2 wings on either side right there. Finally, we've got the sphenoid bone again. The sphenoid bone, that's that butterfly-shaped bone. Right here, it's a little bit hard to see from this inferior part, But this right here is going to be the pterygoid process. Those two plates that stick down off the bottom of the sphenoid bone. So I'll label those there, the pterygoid process. We can see those pterygoid processes pretty well in my skull right here. We've got the pterygoid processes right in there. We've got the palatine bone down there. And this is the nasal septum, which will be made up of like the vomer right there and the ethmoid bone as well. To study or not to study? That is the question. Anyway, I don't know Shakespeare very well. Let's continue on. So not pictured here is the ethmoid, the lacrimal, the nasal, the inferior nasal concha, and the mandible. Basically, most of those like kind of facial bones that we can't see from this inferior part. So there's our completed inferior diagram. Not that it's worse than the others, it's inferior from the bottom. Now we have covered a lot of stuff. So like I said, I have a study guide that goes with this. It's free. You can find that link in the description. That's going to give you a lot of ways to practice all of this information so you can learn it really well. And before we go, these are some color-coded images provided by Anatomage, and all three diagrams are color-coded the same. So another chance to pause the video, see if you can identify all of these bones in these diagrams, and I'm going to go ahead and go through them. One last review of this before we finish. So we've got the frontal bone right here and right there. We've got the parietal bones right there. You can see the right and the left parietal bones. You can see them right there as well. We've got the occipital bone back here, which we can also see right back here in the foramen magnum right there. The occipital condyles right there. We have the temporal bone right here. We can see all the processes sticking off of the temporal bone. You see that temporal bone right there. There's that styloid process sticking off. The external acoustic meatus right there, of course. We've got the sphenoid bone, the lateral surface there. The orbital surface of the sphenoid bone, the greater wing, the lesser wing, and we've got the inferior part of the sphenoid bone with those pterygoid processes sticking down. We have the zygomatic cheekbones right there. We can see them right there as well as right here. We've got the maxilla, kind of the cornerstone of this. It extends all the way up to the frontal bone right there. There's the maxilla. There's two bones, one on either side, of course. We've got the mandible right here and right here. The coronoid process, the mandibular condyle, which connects the mandibular fossa of the TMJ joint, to the mandible right there, and then of course right here. We've got the nasal bone right here and right there. We've got the lacrimal bone in pink right there and right there. We've got the ethmoid bone, you can see a little bit right there and right here, the nasal concha right there, the perpendicular plate. We can see the ethmoid bone a little bit in this view. We've got the palatine bone right there, and we've got the vomer right here with the two wings, and we can see the vomer right there as well. And then here we have the inferior nasal concha, which I think we can actually see a little bit right there. So hopefully that was helpful and you learned a lot about the bones of the skull. Special thanks again to Anatomage. This video would be very different without all of the 3D cadaveric images that they provided. For us to really visualize these structures three-dimensionally, especially the ethmoid and sphenoid bone, like it's just so important to be able to visualize spatially where all of these are located. So check out the link in the description for more information about Anatomage and their life-size virtual dissection table and their tablets that they have. And all of their models are scanned from actual cadavers. Very cool stuff. So check those out in the link in the description below. Special thanks to everybody who supports this channel, whether it's on Patreon or YouTube channel memberships or part of my Memory Lab program. There's some names on the screen, so thank you all for supporting the channel. And if you're learning anatomy and you want more help from me beyond just the YouTube videos that I have posted for free, I've got some paid products such as my A&P study cards, my comprehensive guides for each system, and again, I've got that free study guide for this video down below. And if you're ready to move on to the next topic in your study of the skeletal system, here's my full skeletal system playlist. It's got all of my skeletal system videos, so you can kind of binge those if you need to, if you're cramming for a skeletal system test or something. Hopefully this video was helpful, and I'll see you in the next one. All right, bye.